there, everybody. I want to go ahead and get started. I don't know how many people are going to be able to join the live stream, and I know that there's no one in here right now. But the great thing about live stream is that you can come back and take a look at the stream later. You don't have to actually be on here now in order to be part of the conversation. So I want to thank you all for joining me, even joining me later for this very important chat on healthcare. I wanted to just take about a half hour just to talk about the importance of ensuring that we have healthcare, a healthcare system that works for everybody in this country. The thing about healthcare, well, let me first of all say, before I get into the crux of what I want to talk about, first of all say that this live stream is only going to be about 30 minutes, and hopefully through the course of the campaign we can have several of these kinds of chats so that when people have questions, or as people have questions about various platform positions that I am advancing because of the desires of the individuals in the 8th District, the community has shaped my agenda and has said what is important to them. And so those things that the constituents of the 8th District deem important, I have crafted a platform that I'm interested in taking to Washington, D.C. in order to advocate for the folks in our district. And so the most important issue, there are 3 platform issues that I am advancing as a result of having talked to people in the district who has said this is what's important to me. That is healthcare for all, education from preschool through college, and economic development and job creation. Those are my top 3 platform issues. And as I said, shaped by the district, shaped by the community, and not by myself. So to get into a discussion about healthcare, I actually came across an article last week that troubled me deeply. For those of you who follow me on my Facebook page, you know that I posted something several days ago about a family who had a child fall. So the baby fell, and I think the kid was about maybe 2 or 3 years old, and had quite a fall. And what happened next was the family went to the emergency room just to get the baby checked out and make sure that he was okay. And a couple of months later, they got a medical bill for $18,000. And that $18,000 was a premium that was tacked on to their bill as a trauma charge. And basically all that happened is they recommended that the family just watch the child. They took him home, and there was no further or additional care or treatment. But that family still received an $18,000 bill for what most of us would deem a routine visit to the emergency room. And certainly as a mom, I had several occasions where I had to take my children to the doctor because of a fall, or in fact, I don't know if we ever went to the doctor for a fall, but for various other things such as accidents on the sports field and just normal, routine, everyday, run-of-the-mill kinds of things that can happen to any kid. Because as children are rambunctious, they play, they have fun, and as parents we worry about stuff like that. But when a child has a fall, and especially when they hit their head, I know most of us parents are going to want to make sure that our children are okay. And I see Ray Jane just came in to the chat. So Ray Jane, hi there, and welcome to the chat. It's wonderful to see you. Ray Jane and I have worked on the front lines fighting for justice over the years. So it's a pleasure to actually see you in the chat. And Russ, Ray Jane's husband, happens to be my webmaster for the campaign, so it's a pleasure to have Ray Jane here. But as any parent knows, and Ray Jane's a mom as well, when anything happens to our children, we want to make sure that they are okay and they're in the best care. And I just believe that we should not have to worry about taking our children to the hospital and making sure that they're okay. Healthcare to me should be a right. And hi there, Susie. I didn't see Susie come in. And please share the live so that other people know that we're on here, we're talking about such an important issue, the issue of healthcare. So please do share the live. And Susie and Amy, I see Amy in the chat as well. Hey there, Amy, how are you? Such a pleasure to have all of you here to talk about healthcare. And as I was saying, healthcare is a right. It should be a right in this country, and it's something that we have not yet acknowledged as a right. But so many of us work jobs every day, and we still struggle to pay our medical bills. Medical bills are extremely high. The cost of medical care is extremely high. And I think some focus and attention needs to be put on why is it that we're struggling to cover those most important costs and to care for ourselves as a nation. You know, it's very troubling to me to understand and know that we are the only industrialized nation in the world that does not have some form of universal health care, a single payer system. And, you know, under the previous administration and the passage of the Affordable Care Act, more than 17 million Americans finally gained health insurance, and millions of low-income Americans were able to get coverage through the expanded Medicaid system. Even here in Ohio, we saw the expansion of Medicaid being introduced by the governor of Ohio, a Republican governor, I might add. So this is not, healthcare is not and should not be a partisan issue. 31 states have expanded Medicaid because they understand the importance of healthcare for all. And, you know, we definitely want to begin to move in the direction of ensuring that folks are covered. But I bumped into a young man at the bank the other day, and, you know, he was excited about the fact that I was running. And one of the things that he said to me, he asked me about my top 3 platform issues. And one of the things that he said to me is, he says, I am in my 20s. And he said, I have a pre-existing condition. And I'd love to be able to take on another job and advance in my career, but I'm stuck. I'm stuck here in this particular position. He said, this is a great company. And he said, but at some point, I want to be able to advance in my career. I want to do better. I want to live better. He said, but I can't go anywhere because I have a pre-existing condition, and the legislatures just rolled back the legislation to reintroduce pre-existing conditions. And so therefore, we are now back in a position where we can't just move from job to job or even advance in our careers, because if you have a pre-existing condition, you're going to be tied to an employer based on health care. So I think it is an important debate. It's something that we definitely need to be talking about, and we definitely need to be raising awareness about. 29 million Americans today still don't have health insurance, and millions more are uninsured and can't afford the high copays and the deductibles that are charged by private health insurance companies. I want to also say, just in case that young man chimes in, because he also said that he's interested in helping with my campaign. He's been a Republican his entire life. One of the things that he said to me is, I would like to see the private healthcare industry maintained. I don't want to see choice taken away. And, I echo those sentiments. The objective is not to take away choice in healthcare, but it is to ensure that every American has the ability to cover the cost of basic healthcare. That's what I'm concerned about. And thank you so much for the people who are commenting in the live. I do have my computer up and going here so I can see the things that folks are saying. And Amy says it's truly a life and death situation. And Amy, you're absolutely right. No one in this country should ever work a full-time job and to die because of the flu. And I say that because in a real live situation and a real life story, a young woman, 33 years old in Texas, was able to afford, this was a couple of months back, before May, during my primary, I saw this news headline that said, the 33-year-old teacher in Texas dies of the flu. She had the resources to go to the doctor and to pay her copay so she could get diagnosed and find out what was wrong with her. But what ended up happening is she couldn't afford to pay for the medication. She had private insurance. She had the money to pay to go and see about herself and see what was wrong. But ultimately, she could not afford to cover the cost of her medication. And she died. A 33-year-old teacher died because she could not afford her medication. So I want to ensure that we don't allow politics to enter into this conversation, and that we understand that this is something that impacts all Americans, regardless of your political persuasion. It is something that we definitely want to ensure that our government pays attention to. And the only way to ensure that our voices are heard in Washington is to elect people who can take that message to Washington. Our current legislator has never been in a position of struggle to the extent that he doesn't understand the need for basic health care, or the challenges that people face who may not be, a one percenter. He does a great job of representing the 1%, but the rest of us, the 99% of us, don't have representation in Washington, and that's why I'm running. We need people who can go to Washington and understand what it's like for those of us who are not wealthy, those of us who have not been born with the silver spoon in our mouths, those of us who have not had wealth passed down and transferred to us. I have a doctorate degree. I've worked hard my entire life, and I still struggle because even when you do things the right way, there's still the potential for things to come up, for healthcare emergencies to come up. There is no person in this country that cannot potentially have a healthcare emergency and to have to go to the doctor. Most of us could not afford the exorbitant bills that might come out as a result of us showing up in an emergency room or even at the regular doctor's office, because once we go to the doctor, there are tests that have to be run. There are x-rays that often have to be run. All of those things cost money. We also have to consider the fact that deductibles and premiums and all of those kinds of things factor into the equation when it comes to health care. And so I want to just go back to the comments again. I see people who are commenting, and thank you so much for being here, and thank you even more for commenting. I saw somebody had posted something saying that, I have their vote as a result of, the conversation on health care. Thank you so much. Grace comments and says, do you think that every major health insurer in this country considers the VA hospital to be out of network? I'm lucky enough to have VA coverage and a good employer health care plan that will cover my family. The VA will provide care to any veteran, and you can use your private insurance, which costs the taxpayers less because it is considered out of network. The taxpayers are paying a higher rate than they need to. It is shameful. I agree with you, Grace. That is absolutely shameful. And I want to go back to there was a town hall meeting that occurred in the district a while back, and the current congressperson in this district, the seat that I'm actually running for, it's Boehner's old seat. At that town hall meeting, he made a comment to a young man who worked in the fast food industry. His mother was the one who had brought up her son's issues with the high cost of health care. And he actually said to that mother, he said, well, if your son wants better health care coverage, he needs to get a better job. So for those of you who are moms out there, can you imagine, you know, we all want the best for our children. And this particular young man is working, gainfully employed, working full time, and he's a taxpayer, and he is doing what we all want people to do, young people to do. We want them to work. We want them to make a living. We want them to be gainfully employed. But to say to a mother that her son then needs to get a better job, as though better jobs are just falling off trees, or as though everybody has the wherewithal and the capability to, you know, just go out and get a new job and get new health care, or as though there are some people in this country that don't deserve health care. And that bothers me immensely. That health care should be a right for everyone. It should not be that only wealthy people who can afford the exorbitant cost of health care should be able to get health care. That actually leaves 99% of us out of the equation as far as health care is concerned. And we all deserve health care as a basic right, which is why I'm fighting for this district. I'm fighting to get the message out about the importance of health care. And, you know, I think that when it comes to copays and deductibles, that there are very few of us that can really afford the high cost of medical coverage without insurance or without good insurance. We would all struggle. We're all one paycheck away from being on the street or losing our homes, or one death away from being in trouble, you know, being saddled with medical bills. And, you know, my husband died in 2009, and one of his major concerns was, you know, with having fallen ill as a young person, how that would leave us with debt and medical bills and that sort of thing. So I think that it's important that we have this conversation, and especially that we understand that there are alternatives to the system that's currently in place, that there is an opportunity for us as a nation to do this the right way, to go in the right direction as far as healthcare is concerned. You know, the U.S. spends more money on healthcare per person and as a percentage of gross domestic product than any other advanced nation in the world, including Australia, Canada, Denmark, France, Germany, Japan, New Zealand, and the United Kingdom. We are way behind on creating a system or ensuring that the people in our country get the best care. As a young person coming up in school, I always felt as though America was the best place in the world to live. And, you know, I could not have been convinced that we weren't the best place to live. And with the current healthcare system that we have, we're actually on the bottom of the rest of the world. And I just cannot imagine that this is the reality of a nation as great as ours. And there are opportunities for us to really improve on how we do healthcare. And I hope that people will make their voices heard at the ballot box in November to ensure that we do support candidates who support us. I think that this healthcare issue is a one of great debate. In fact, our current legislator does not believe that everyone should have access to health care. And I think that that is a huge miss on his part. The people of Ohio, their voices have resonated loudly to say that we need health care. Millions of Ohioans have pre-existing conditions. I think in this district alone that there are 300,000 individuals in this district who have pre-existing conditions that will be impacted by a loss of health care, or even not being able to transport health care with them when they go from job to job because they do have a pre-existing condition. So I actually applaud our Republican governor who has made it a point to expand Medicaid, because he has also acknowledged that Ohioans, their voices have been ignored for years in saying that we need health care. However, that is not the side that our current congressperson sits on. That's not what he believes. And so if we continue to elect him to Congress, then we can guarantee ourselves that we will not see healthcare improve in our nation, because that is a vote for our district that is not going to resonate with the voters in the district. And let me see what, I'm going to go back to the comments. And Susie says, even if you qualify for Medicaid or the expanded Medicaid, it is hard to find a provider who will accept it, especially if that provider is a specialist. And that actually goes to the whole argument that we need Medicare for all. We need to ensure that all people are covered, and that we're not looking at this as a welfare or as a stigma. This is something that, just like we pay for libraries and fire departments and police departments, this is something that we should be paying for, because it covers basic health care for individuals, for people. We need to care more about people, and to ensure that when we make decisions, that we're making decisions with people in mind and not profits. And so I think that that would alleviate those individuals who are not willing to take coverage from folks simply because of the stigma associated with it. Amy says it absolutely should be a right. Thank you, thank you, thank you. I have to go back to my job. That was my health care, that has my health care. I appreciate your views. You have my support. And I am very, very conscious of the fact that many people are working in the middle of the day, and we'll have these chats at various times to make sure that we have an opportunity to engage people who are working. But this happened to be the time that I had available where I could talk a little bit about healthcare and my passion for healthcare, and why it is that I've decided to make this one of my top 3 priorities. Of course, there are other things that I care about and that you care about and that you've told me you want me to do in Washington. And all of those things will get done too. But the top 3 priorities, again, are education, healthcare, and economic development / job creation. Those are the things that you want to see, and those are the things that I want to ensure that we have happen. Yes, Carol, the post will be on the webpage for people to view later. And I ask that you also share this post so that other people, we can broaden the audience, and other people can be privy to the conversation, because I think that healthcare and the need for healthcare has been ignored in this country. And I applaud those of us who stood up when Congress said that they wanted to repeal the Affordable Care Act. Those of us who stood up and said, no, you cannot do this. As a small business owner, I can tell you about how challenging it is to cover the cost of employee health care, as well as pay for my own health care. And so I am grateful that so many people have stood up and said, we need health care, and you're not going to take health care away. Now, I was very disheartened to see that Congress found a backdoor to taking away health care. So instead of being able to pass it through the channels, through congressional channels, because some Republicans voted against it and they didn't have enough votes to pass it, what they then did was went and got a judge to say that the part of the Affordable Care Act was unconstitutional. And once they were able to say that it was unconstitutional, now they're trying to get a ruling that says that all of it is unconstitutional and that it should all be repealed. And that's why it's important to also pay attention to who our judges are. If you have not already, called your congressperson, your senator who will be voting on the judicial selections, please pick up the telephone, make your voice heard on that issue as well, because judges are making decisions about our health care, and we need to, as a nation, stand up and to make sure our voices are heard. But one of the ways that you can make sure your voice is heard is on November 6th, by going to the polls and voting. I'm urging young people who are just starting out in their careers, and you've already seen the challenges of trying to cover the cost of health care, that you go to the polls and vote. The law has been from the previous administration that as long as you were 26 years old, you could be carried on your parents' insurance. Well, again, because affordable care is now being overturned, that will also not be the case anymore. And so children, college graduates, our children are now going back to struggling to cover the cost of basic health care. All of us should be entitled to and should have the opportunity to have our basic health care covered. We've got a couple more minutes. Let me go back to the comments. And Carol, thank you so much for sharing this. Grace says, under the plans of our current administration, who is supported by our current congressman, every female child born in this country is automatically considered to have a pre-existing condition at birth. Imagine that. Imagine that. Just because you were born a female in this country, you already are born at a disadvantage. And I want to say that as well. The thing that actually caused me to get into this race to run for Congress, I saw a headline that said, "Men decide the fate of women's health." And ultimately what came out of that room, the decision that was made, is that maternity care should not be covered by health care insurance. Now keep in mind that the same men who made the decision to not cover the cost of health care for maternity, that means delivering children, the same men who made those decisions did not eliminate health care coverage for Viagra. And I just think that that is a travesty. So we can pay for performance drugs, but we cannot pay for basic health care coverage for women having babies. We definitely need to balance our Congress and ensure that there is representation of men and women in Congress. We need that balance. As a woman, I would be the first woman to ever hold the seat as a congressperson from the 8th District. And I'm asking for you to go to the polls in November and vote for me. 63% of the women in this district live in poverty, and children, when women live in poverty, so do children. So if we all go to the polls, there are more women in this district, and so we know that there's more suffering in this district. So if we all go to the polls, whether you're a woman or a man, and we vote to put a woman in that seat, we will be voting to ensure that we are covered in terms of our health care. There are other reasons I want to ask for your vote in November, because I'm also qualified. My doctorate degree is in public policy and social change, so I understand what good public policy looks like. I understand that good public policy represents all of us, the entire electorate, and not just a select few, as is being represented in Congress right now. There are so many reasons why We need to ensure that there is balance on that Congress. And Grace says those same men also claim to be pro-life. So I'm gonna leave that right there. That is an excellent comment, and I want you to at least be left with something to think about. But moreover, I ask that you share this post. I will be coming back to you probably on Friday afternoon, and that particular session will be an About Me session. I want to talk a little bit more about who I am so that people understand who I am, my experiences, and to give you a little more background on me. So I look forward to talking to you hopefully on Friday, and thank you so much for being here. Thank you for sharing this post. And I appreciate those of you who have said you have my vote. That is the most important thing, that we elect new faces to Congress who understand the needs of the American population. Okay, thank you so much, guys. Thank you for being here, and I look forward to talking to you again soon.